I'm Melissa Burdi. I'm the Vice President and Dean for the School of Nursing at Purdue Global. It's extremely important to talk about heart disease because it's the leading cause of death for men and women globally, and it's not talked about enough. The heart simply is connected to every organ in the body, so when there is heart disease, we see manifestation of this in a variety of ways. Well, February is American Heart Month. Every month really should be Heart Month, where we are routinely looking at our overall health, but assessing for vital signs, blood work, electrocardiograms, key indicators that really help us to understand the state of health for our cardiac health. There are many risk factors for heart disease, including primary and secondary risk factors. So when we think about the primary risk factors, these are things that you work on towards preventing the actual heart disease from happening. And that consists of hypertension, managing high cholesterol, managing obesity. We know that that is really become an epidemic in the United States over the last 40 years. So putting measures in place to combat obesity or prevent obesity, and really taking a hard look at what we are consuming, both with our diet and also monitoring and really being mindful of alcohol intake that we have. Some of the ways that a person can help prevent heart disease is just being aware of what the risk factors are. And so when we think about risk factors, we think about our genetics. We know that African American and Hispanic populations are more prone to having hypertension. As an example, hypertension is one aspect of heart disease that can lead to coronary artery disease, atherosclerosis. Eating fresh, cooking fresh, consuming fresh ingredients, those who do or are impacted by cardiac disease often will refer to the cardiac diet or the DASH diet. And so the DASH diet stands for dietary approaches to stop hypertension. And again, that's really looking at our sodium intake. We want to make sure that we're keeping our sodium to less than 2 grams of sodium per day. We can often do that by eating fresh, using lean meats, cooking with lean meats, incorporating whole grains into the diet, and being very mindful of the type of fats that we're using. Increasing physical activity and exercise is very important. A lot of folks will often use apps to track their exercise, and that's a great way to keep track of your movement throughout the day. And last but not least, of course, maintaining that positive mental health is key. It's so important in today's world with the stress and the many triggers that are present that we're mindful of them, we're aware of them, but that we are engaging in some relaxation, some deep breathing to help really ground ourselves and decrease that stress, which often can lead to hypertension or high blood pressure if we don't control that. Those are the ways in which we can really help prevent heart disease, knowing the genes, really looking at our consumption, engaging in physical activity, maintaining positive health, and then, of course, always engaging routinely with your healthcare provider to do an assessment of your vital signs, looking at your blood work, and then, of course, routine electrocardiograms to determine whether or not there could be any type of arrhythmia present, which really lends itself to a whole other series of challenges from a cardiovascular standpoint.